Significant news has been announced regarding the detection of the poliovirus in wastewater samples in Germany. This event is noteworthy as it marks the first time wild poliovirus has been found in Europe since 2007. At that time, the virus was recorded in Switzerland. In Germany, the last case of poliomyelitis was observed 30 years ago. Poliomyelitis, polio, is an infection, primarily affecting children that can damage the nervous system, in some cases leading to paralysis or even death. However, thanks to mass vaccination, cases have decreased by 99% since 1988. This is considered one of the most effective prevention campaigns in the world. A system for testing wastewater for the presence of poliovirus was implemented in Germany starting in 2021. The newly identified virus was also found through this exact monitoring. Importantly, this does not mean the virus has begun to spread among the population. On the contrary, such monitoring systems allow for the early detection of viruses and the implementation of emergency measures. According to the World Health Organization, WHO, wild poliovirus is currently considered endemic in only 2 countries in the world, Pakistan and Afghanistan. This means the virus circulates regularly in these countries. In other regions, viruses that are detected are often imported from external sources, or they are vaccine-derived forms of poliovirus. Vaccine-derived viruses are much weaker than the wild type, but surveillance systems are designed to detect both types of virus. Experts emphasize that the risk of polio spreading in Germany is very low. The reason is that a large portion of the population is vaccinated. A high vaccination rate virtually eliminates the possibility of the virus spreading among people. Therefore, the current situation is not a cause for alarm, but rather an indication that the control systems are working well. Testing sewage water is one of the most effective epidemiological surveillance methods used worldwide. This is because any virus that enters the human body eventually leaves a trace in the wastewater system. Therefore, many countries use this exact method to detect new viruses or potentially dangerous variants. In conclusion, the poliovirus detected in Germany does not pose any threat at this time. However, this situation reminds us once again how important monitoring in the healthcare system, scientific oversight, and most importantly, vaccination are. Disease prevention always begins with vaccination and early detection.